First, I begin by sending my condolences to the families of the 3 people that we lost over the past few days. We are again reminded of the human cost that this virus has imposed on families within our community, and our thoughts and prayers with the loved ones of those lost over the weekend and yesterday, as well as with all the families who have been impacted by loss during this pandemic. I welcome and thank the Minister of Health, the Honorable Kim Wilson, for joining me tonight as she provides an update to the country on our latest coronavirus test results, vaccine data, and other updates from our ministry. Following the minister, I'll reiterate the regulations which came into effect at 5 a.m. this morning. And we are joined this evening by Dr. Wesley Miller, who is the Chief of Staff of the Bermuda Hospitals Board, who can answer any questions related to the Bermuda Hospitals Board. First, we will hear from our Minister of Health. Minister?
Good evening, everyone. The Ministry of Health received 578 test results since the last update, and 12 were positive for coronavirus. This gives a test positivity rate of 2.1%. One of the new cases is classified as imported by a resident who arrived on American Airlines flight AA2044 from Charlotte on the 18th of April, 2021, and tested positive on their arrival test. 3 of the new cases are classified as local transmission with known contact as associated with known cases. The additional 8 new cases are classified as under investigation. These cases are among residents with no currently identified link to either known cases or history of travel in the past 14 days. Additionally, since the last update, there were 23 recoveries and no deaths. There are currently 893 active cases, of which 858 are under public health monitoring and 35 are in hospital, with 6 in critical care. Since March 2020, Bermuda has recorded 2,226 total confirmed cases of COVID-19, and out of those, 1,313 persons have now recovered, and sadly, 20 persons have succumbed to COVID-19. The 7-day average of our real-time reproduction number is 0.76. Bermuda's current WHO country status remains at community transmission. Please keep in your prayers those persons currently in hospital due to COVID-19 related illnesses, as well as families who are suffering the loss of persons to the coronavirus. There's still an intense outbreak, and the virus continues to circulate within our community. We are not out of the woods yet. Are we on the right path? I think so. Our numbers of positive cases is slowly going down, and we're seeing more recoveries. Things seem to be getting a bit better, but hospital admissions are still too high, and the numbers of deaths is troubling. My sincere condolences again to the families of those persons who have recently lost loved ones to the coronavirus. I would now like to proceed with our vaccine program update. We have completed the 14th full week of vaccinations. From January 11th to April 17th, 2021, Bermuda has administered a total of 50,992 vaccinations, and that figure rises to 52,337 if you include vaccinations that were administered on Sunday and Monday as well. And all of this, again, is very, very good news. Of the 50,992 vaccinations administered for the period we are reporting on, which again ends on the 17th of April, 53% of those persons are women and 47% of those persons are men. Significant progress has been made in vaccinating our population, and especially our most vulnerable. 70% of all residents over the age of 65 years have had at least one vaccination, with 61% being fully immunized. Bermuda's goal of herd immunity will be achieved when 70% of the population has been immunized. To date, 46% of the population has been vaccinated, namely having had 1 dose, and 34% of the population has been immunized. That means they've had 2 doses. People have asked for an explanation of herd immunity or community immunity, and why is it so important? Community immunity happens when enough persons in our population have protection against an infection, and it stops being able to be spread, or it's so-called, comes up to a dead end effect. For COVID-19, Scientists estimate that the threshold for community immunity is between 65 to 70% of the population. In Bermuda, that means something closer to 80 to 85% of the population that is eligible to be vaccinated, because as you know, the vaccines have not yet been approved for persons under the age of 16. So once you remove young people from that calculation, we need a much higher rate of vaccination among those who are left, namely those persons that are 16 years of age or over. Yes, this is a very ambitious target, and that is why the ministry has focused on and worked hard to achieve a high rate of vaccination amongst our most vulnerable group, people over the age of 65 years. And again, to date, 70% of that age group have had at least one vaccination, and that is excellent news. In a recent omnibus survey that consisted of telephone interviews with a representative sample of 400 Bermuda residents conducted between March 8th and March 17th of this year, only 8% indicated that they will definitely not get the COVID vaccine. And this is a decrease when compared with the December results of the omnibus survey, when 28% of the population indicated that they would not get the vaccine. I will continue to encourage those not registered to be vaccinated to do your own research using reliable sources and to speak to your doctor. I know that some of the reluctance to get vaccinated is due to concerns about side effects. I cannot speak for everyone else's experience, but I can speak for my own. My arm was sore after the first shot, and that was all. After the second shot, which I had around 9 o'clock in the morning, I felt fine throughout the day, but I did wake up around midnight with a very, very bad headache. I was able to take some pain reliever that evening, and I actually felt kind of flu-y. However, I was feeling absolutely fine within 24 hours. And there's certainly a better sense in me now of relief knowing that I am fully immunized, so I can have the protection for myself, my family, my loved ones, and the other members of our community. So yes, getting vaccinated is something that we can do for ourselves, but again, we do it for our family and for our community. And immunization is the only way for us to get out of this pandemic. The expansions in the vaccination program at the Bermuda College and the hospital have helped us to exceed over 5,000 doses in 1 week for the first time, and that is well done and a huge achievement. And again, I have to send my personal thanks to all those persons that are working at the Bermuda College as well as the Bermuda Hospital Board's vaccination centers. Well done, and kudos to all of your hard work and your efforts. The vaccine program has expended our hours and days so that we can move towards community immunity. To push us towards achieving this goal, the Bermuda College is accepting walk-ins this week, Thursday to Sunday, from 8 a.m. until 8 p.m. You do not need to register, just show up. Again, that's at the Bermuda College, Thursday to Sunday, from 8 a.m. until 8 p.m. I will now briefly speak to the Public Health COVID-19 Emergency Powers Stay-at-Home Regulations 2021. The revisions that went into effect earlier today were necessary and a part of the necessity to help to protect our community. They are not designed to make people's lives harder. We understand the economic and emotional strain that this is having, but the outbreaks, which we see, in the closed-in settings with mixed households, people not following guidelines of public health and not adequately using personal protective equipment. If we do not follow the public health guidelines and safety measures as outlined in the new regulations, our community spread will continue, hospitalizations will increase, and sadly, we will see more COVID-related deaths. I will remind you that if you are back at work, do not mix and mingle with your coworkers. Contract tracers have identified your work environments as the major reason for transmission, including driving in the same car or truck in order to get to a work site. Your colleagues are not part of your personal bubble. Sharing a lunch or break room without adequate protection has also led to outbreaks. In all situations outside of your immediate household, you must wear your mask, keep physical distancing, practice proper hand hygiene at all times. We see these types of workplace transgressions regularly, and I cannot overemphasize that the mixing of households has gotten us to where we are today. Before I close, I would like to extend my appreciation for the environmental health team. They have been carrying out invaluable work trying to manage the COVID-19 pandemic since its start. And this is included as part of the overall port health team, monitoring all travelers arriving in Bermuda at the airport and the seaports to ensure compliance with the quarantine laws and the traveler rules, carrying out investigations of cases and outbreaks in businesses, workplaces throughout our community, and providing advice and support to businesses on legislation, guidance, and best practice to help prevent the spread of the virus. At the same time, they've continued to provide essential services such as vector control. So thank you to that entire team. As a reminder, each of us has a role to play in stopping the spread of the coronavirus. Follow the public health guidelines, wear your mask, practice good hand hygiene, maintain physical distancing, and download the We Health Bermuda app. And if you haven't already done so, register to get vaccinated because vaccinations are what is going to get us out of this pandemic. Thank you.
Thank you, Minister, and I certainly echo your message of keeping those in hospital in our prayers. As of this morning, the strict stay-at-home order period has ended. This short and sharp stop to activities has allowed our essential services such as contact tracing to catch up on the high volume of work they were faced with and allowed us to meet the objective of increasing our pace of vaccinations, as the Minister of Health just indicated, while also expanding our testing. I wish to thank all those who adhered to the order and stayed at home. And I want to also thank the teams who have been working on the front line of the pandemic. And those teams also thank the persons who stayed at home for their cooperation. Each of us plays a significant role in our country's success against the coronavirus. Whether we are on the front lines working in healthcare and essential services, a staff member of a permitted business, or a resident staying at home. Our progress is reliant on all individuals making responsible decisions in the interests of the collective safety of their family and the Bermuda community. As we enter the next phase of regulations, I ask that each person watching and listening remembers that the ultimate purpose of such measures is to protect you, to protect your loved ones, and to protect Bermuda. We recognize that even with the best of intentions, to live under restrictions is frustrating and tiring for many. But I encourage everyone to please keep the end in view. Our vaccination program has accelerated, and we are making consistent advances toward our goal of community immunity. Community immunity, combined with increased vigilance at our border, will allow many of our restrictions to be but a mere memory. However, we can only get there if we remain united and not think just about ourselves, but about the entire community. The government is being led by the data, and as we decide what each phase on our road to reopening will entail, it is with this in mind and with consideration for our healthcare system and our economy, the following changes took effect this morning. Curfew is in place from 8 p.m. to 6 a.m. every day. Household mixing is not permitted. Permitted businesses, including grocery stores, pharmacies, banks, gas stations, and registered health professional offices and facilities can continue to operate between the times of 7 a.m. and 7 p.m. Grocery stores will continue to operate on the alphabetical system. Retail stores, including pet stores, will be permitted to open for curbside and delivery service from 7 a.m. to 7 p.m., as well as restaurants for takeout and delivery services only. Laundromats will be permitted to open from 7 a.m. to 7 p.m. and open by appointment for one household at a time to ensure that we reduce the mixing that the Minister of Health was speaking about. Wash and fold services may be provided as long as customers are not permitted to enter the premises during drop-off or collection of laundry that would lead to the mixing of households. Licensed fishermen and registered commercial farmers are permitted to sell local fish and produce respectively on the roadside and may also continue to engage in delivery. Construction, maintenance, and landscaping services are permitted to resume on outdoor sites and for indoor sites that are vacant or uninhabited. It's important, of course, that individuals who are returning to work get tested very important. Courier, delivery, and trucking services are permitted to operate. Speak to the courier service about delivery and curbside pickup of your package if needed, as you are not permitted to enter these premises. Parks, beaches, playgrounds, and wayway trails are open, but you may only visit with members of your own household. Golf courses are open for use by a person and members of the same household, but the clubhouse and other facilities must remain closed. Recreational boating will be permitted for members of the same household only. Tying to other boats or rafting up is not permitted, and this will be strictly enforced. Schools remain closed. Nurseries are also to remain closed except for those approved by the Ministry of Health to care for the children of essential workers. Remote working remains mandatory. If you are able to work from home, employers should not force employees to come into work if they are able to perform their duties from home. If you feel that you're being asked to come in against the law, please report it on the Employment Violations Tip Line, which we gave at last week's press conference, and that address can be found online at bermudajobboard.bm/EVTL. To answer just a few previous questions that the government has received in regards to the latest regulations, there is now no restriction on the amount of time a person can exercise outdoors. You do not have to stay within 1 kilometer of your home. However, there is one restriction that remains: no mixing of households. Minor children of parents who do not live together may spend nights at the home of either parent to give an effect to an arrangement between those parents. It's important for us to remember that our WHO transmission status is still community transmission of the coronavirus in Bermuda. And it is imperative that we continue to be vigilant as we go about our daily lives. Please continue to wear your masks, practice social distancing, and sanitize. These regulations will remain in place for at least the next 2 to 3 weeks, at which point the Ministry of Health will review the data and make recommendations to the Cabinet. For those of you who are now returning to work in retail, restaurants, or other businesses allowed to operate as allowed in the latest regulations, such as construction and/or landscaping, the government encourages you to take advantage of the free testing for status. There is testing available every day, Monday to Friday, at either end of the island. And this is part of the new testing strategy, which was able to be rolled out during our 7-day pause. Employers, ensure that your workplaces are safe. We have allowed some economic activity to return, but it is vital that employers ask for employees to be tested to ensure that you do not subject your business to a 14-day shutdown due to quarantine. It is essential that we do our job to remain safe and have safe work environments. That means that you should not in any way, shape, or form deviate from the guidance of which has been issued from the Ministry of Health. Mask wearing at all times, social distancing, and also ensuring that you are continuing to sanitize. Again, the testing is free and available, and you can find the link to get tested at gov.bn. For those persons who are still unable to work due to business closures and are in need of support, please go to uba.gov.bn to apply for the unemployment benefit administered by the Ministry of Finance. Support also remains for affected businesses through the Bermuda Economic Development Corporation. They can go online to bdc.bm to apply for the updated and expanded COVID-19 emergency grants, as well as the updated and expanded COVID-19 combined loans and grants under the Business Continuity and Sustainability Funding Program. While contact between persons must remain to a minimum, and with the difficulties that this pandemic has brought, we know, and I know from personal experience, that there are persons going through a difficult time emotionally. The Emotional Wellbeing Hotline is now open Mondays, Wednesdays, and Fridays, and Saturdays from 5 p.m. until 9 p.m. And they are here to help you. If you or anyone you know requires extra emotional support, please call 543-1111. Do not keep the challenges you are facing or your emotions to yourself. If you need help, please reach out. Also, if you're in an abusive situation and need help, the Center of Abuse offers a 24-hour helpline on 297-8278, where there are counselors and conduct sessions over the phone. If you have an emergency, dial 911. You do not need your permission to leave home in an emergency, even while the curfew is in place from 8 p.m. until 6 a.m. On Sunday evening, I will address the country and provide an outline of where we have been, where we are now, and what the future will look like for Bermuda. The goal of the national address will be to share with the country what we have learned throughout our battle with the coronavirus, how we have adjusted our response and roadmap for the return of a sense of normality for our beloved island. Further details will release in the coming days, and I encourage all to tune in. I remind all of Bermuda that our goal remains to achieve community immunity by having the majority of the country fully immunized from COVID-19 and to end restrictions. Taking the vaccine is a personal choice. For those of you who have not already done so, please speak to your doctor about the vaccine and get proper medical advice if it is right for you. If it is, we welcome you to register as soon as you're ready on gov.bm. And it's important to remember that there are persons in our community who are unable to take the vaccine due to medical reasons. And so it's important for those of us who do not have a medical reason to speak to the doctor, and if advised, go ahead and register. In closing, I ask that we continue to pray for our brothers and sisters in St. Vincent and the Grenadines as they contend with the impact of a devastating volcanic eruption in their country. I again thank the Minister of Health and her team at the ministry, my cabinet colleagues, my parliamentary colleagues, and all public, healthcare, essential workers, and all of the army of public officers for the work that they do and continue to do in the service of this country. I thank the people of Bermuda for your patience, cooperation, and understanding of the necessary but difficult decisions we must make as the government. There is hope for a post-pandemic future. Please stay safe and let's keep moving forward together. Thank you, and I look forward to receiving questions from members of the media.
Thank you, Premier. First, we have Don Burgess from Bermuda Broadcasting. Don, you're live. Please ask your questions.
Good evening. Health Minister, in your opening remarks, you said the cases were slowly coming down. Bermuda had the highest number of active infections ever reported last night. How are the cases coming down?
You would have heard us report 12 cases today. Yesterday's cases, but that would have represented 2 days worth of cases. So we do still have quite a number of active cases. However, as the cases are coming down and as persons recover, we are seeing slow but steady progress, which is something to be applauded.
Either you or Dr. Miller, CMO, is the CMO there tonight?
No, the CMO is not with us this evening.
Okay, so, Health Minister, are you willing to adjust the COVID policy in light of the new COVID variants? There is a wide gap in our testing protocol between day 8 and day 14 and nothing after day 14, which is problematic when you look at the long potential incubation period in the new variants. Instead of testing on days 1, 4, 8, and 14, why doesn't Bermuda test on day 1, 4, 8, 12, and 16?
Don, those are questions that we are discussing here at the ministry with respect to our testing regime. I think what's more important to note and to remind members of the public is the fact is that we do have not only a very aggressive testing regime, also bearing in mind the variants, as you rightly said, because there are more persons that are testing positive at day 14, but the fact that we have made testing more easily accessible and available, and that any number of places are available throughout the from Monday to Sunday, where persons can go avail themselves of knowing their status. And we would like to take this opportunity to encourage members of the public to know their status and get tested and register online to go to any of the vaccine centers that are situate throughout the island.
Thank you. Mr. Premier, we've heard from small businesses who are being told by the payroll tax office that there is no flexibility on the due date and that they should have cash reserves on hand to pay. This isn't realistic for some small business owners who right now say that the tax man is being too rigid. To quote a friend of Bermuda, Mark Twain, he said, "The difference between a taxidermist and the tax collector is that the taxidermist takes only your skin." Surely there's some room for leniency.
Certainly, I think there is. I know there's been a delay, but I'm happy to take that matter up with the Minister of Finance, and I'm happy for the Minister of Finance to give an interview with your television station to discuss the work of which the Ministry of Finance is doing. And in addition to hearing from myself on Sunday, next week we'll be hearing from the ministers and the work of which they are doing, because it's an entire team effort in making sure that we continue to combat this pandemic. So I thank you for your questions, and I'm happy to pass those on to the Minister of Finance, and hopefully he can have an interview with your station.
All right, thank you. I don't know if either the Premier or the Health Minister is better to answer this one. We've had 8 deaths in just over 2 weeks and record number of people in the hospital with COVID and the highest number of active infections ever. Why have some restrictions been lifted at this time?
Don, we note that when we have outbreaks, there is going to be a causal impact with respect to more persons that are hospitalized and then subsequent to that to death. It is a very unfortunate reality. We're saddened by it, and we continue to hold the family members of those who have lost loved ones due to the coronavirus in our prayers. We also recognize that as a government, we do have to try to strike a proper balance and making sure that we adhere to public safety and ensure that our regulations are sufficient enough to encapsulate all of the public health measures that are important to keep our society safe. We also, at the same time, have to recognize that the economy also needs to run. And another impact to a person's psyche is poverty, or the inability to pay for services, food, housing, and shelter. So the reality is we are, as a government, trying to strike the right balance. Leadership is very difficult, and obviously yield to the leader of the country if he wants to add more to this. But the reality is we do have to strike the right balance, and we believe that we are doing so with respect to these regulations.
Thank you, Minister of Health. The Minister of Health has nailed it. It is difficult, but it's also important to remember that there is a lag to these items. And so what you see, the case numbers today are representing what took place 2 to 3 weeks ago and not what's taking place now. We put in place a 7-day pause, not if it was just purely in regards to the traditional way in which it would go, there would be a 4-week lockdown. We had a significant period of restriction before. There was a 7-day pause. The reasons that were laid out for the 7-day pause was to give the health system time to breathe so we could increase our vaccinations, increase our testing, and catch it with contact tracing. Progress has been made on all of those items. We have seen record numbers of vaccinations that were issued last EPI week. We now see testing that is available throughout the country at any given times. There is no longer questions that will come from members of the media that will say, oh, I have to wait 3 or 4 or 5 or 6 days for a test. You can go online right now and get a test tomorrow. So we have stood up and made sure that we enhance those things. And you would have heard in my remarks is that we are going to be governed by the data in coming out of this phase. What's also important to note is that the restrictions that are in place now, Don, were less than the restrictions that were in place we went into the stay-at-home order. So it's not fair to say that we're going right back to where we were. This is certainly a stricter period of restriction. And as I said in my remarks, these will be in place for at least the next 2 to 3 weeks. The recommendation is that we give 2 full incubation cycles. And so the stay-at-home combined with 3 weeks after will form that period of time. Now, what we are going to look at is we're going to be governed by the data. So if the data changes, if our positivity rate comes down, if our incidence rate comes down, if our R number continues to fall, then we consider what things can be done more quickly. But we need to make sure we're careful in this. And what I'll speak about on Sunday is the path to making sure that we do not continue to go back and forth. What the country does not need is stop and start restriction. The country needs certainty, and the country needs to make sure that we move past this. We have the tools at our disposal in order to do that, and I'm going to outline what that's going to look like on Sunday.
Okay, and that's great. But how do you reconcile that with the statement issued earlier today by Court Services, which states the continued surge of positive COVID-19 test results the island is experiencing continues to be of great concern to the community. As such, the courts must reduce services further as part of protective measures which are necessary to implement in order to assist in the efforts to reduce the community spread. So on one hand, you're loosening restrictions, but you have a government department increasing them.
I wouldn't go that far than Don, and I would take a different view than you do. You're saying a government department decreasing and increasing. The fact is that we want all places to abide by the rules and regulations which are in place. And so from the perspective of court services, it is evident that we have community transmission. People are contracting the virus and don't know where they've gotten it from. That is the definition of community transmission. And so while we balance all of the various aspects in the country, we have this period of restrictions, which is going to be in place for at least the next 2 to 3 weeks. As the Minister of Health has said, we are making progress. Still active cases are high. If we look insofar as our 7-day average of new cases, I'm looking at my spreadsheet, that has come down from 2 weeks ago. And when we look at the real-time reproductive number, that has come down. And so we are continuing on that effort in that trajectory. And so this is not a day-by-day item. You have to look at trends over the longer term because there can always be day-to-day fluctuations, but we believe that what we've put in place strikes the correct and right balance, tackles the issues of where they are insofar as the mixing, and makes sure to eliminate or to put restrictions on activities which are higher risk, which could cause more challenges.
Okay, thank you. And my last question for tonight, Dr. Miller, in the past, we've gotten announcements from the hospital with regard to staff members testing positive. How many staff members at the hospital have tested positive this month?
You're on mute, Dr. Miller. Dr. Miller, you're on mute.
What happens is that we do have less staff testing positive in the last few days. Unfortunately, the reality is that when it is in the community, staff live in the community, and therefore we unfortunately expected that some staff would test positive. And as a result, we have to put those staff off. Having said that, we also will put staff off who are exposed and who are not positive. And in order to protect the privacy of the individuals, when we have small numbers, we'll rather not give those numbers because it then leads to a guessing game where they think, oh, it's this person or the next. And unintentionally, it could breach confidentiality.
Right. So when you say small numbers, you're saying less than 10, less than 20?
In terms of people who have been positive over the whole period of time, it would be more than 20. But if you take a particular short period of time, then it's less than that. So if you think of the whole length of COVID, yes, it would be more than 20, and there are people in different areas. But if you were to narrow down to a short period of time, I wouldn't want to do that because it will then have people guessing, oh, it must be this person or it must be the next one. And we can't afford to breach confidentiality.
Thank you. Thank you very much, Don. Premier, we now have Earl Basden from Island Stats joining us. Earl, you are live. Please ask your questions.
Good evening to everyone. Premier, what are the things that government look at to require cabinet to decide what's the next form of action for this country?
One of the things we look at the data. We look at where the positivity rates are. We look at the incidence rate. We look at the real-time reproduction number, and we look at the various activities and the risk which they propose. But the one good thing is that this is the first time we've done this, and so it's easy to look back to what was done last year in the various phasing. So does this make the process a little bit easier?
Okay. If we have another spike following this weekend, will the people of Bermuda who abide by all the rules be made to suffer yet again with another lockdown of sorts?
I would sincerely hope that with the measures of which we're taking, that we're not going to have another being so conservative in our approach and having these restrictions that are rather stringent, a little bit more stringent than phase one than we had last year. As there were a few more things that were allowed in phase one that we're not allowing this time around, such as the mixing of households. But we're confident that if people abide by the public health advice which has been laid out, that we won't have to deal with that eventuality. And I will outline on Sunday the changes that will come in place to put an end to this pandemic for the Bermudian public, hopefully for good. But the most important message is that we all have to do our part. And so whether it's community immunity, whether it is making sure that we all be each other's keepers, look after one another, but also make sure to observe the public health advice. If we do that, we'll be okay. Just like we were last year, we will be okay.
It's well known that there are people who have flown in to watch the race this weekend. Those people will be on various boats, but they're coming from different households. How is that going to be policed by the local constabulary that is also going to be monitoring the locals?
I can't speak to how they're going to police. I know that all persons have to abide by the laws and the rules of the country. And so I would expect that those persons are going to abide by the laws and rules of the country. And I'm happy to put the specific question to the Ministry of National Security. Certainly, I think that the regiment and the Coast Guard do some work there as well. And it's important that those matters are going to be policed, absolutely.
Okay. We're currently in some very important we have some very important international commitments coming up for sports in a matter of weeks. But under the current situation, our teams are unable to train due to the non-mixing of households. What do you say to those athletes who will not be fully prepared to represent this country?
Well, I don't know which athletes of which you're speaking about. I do know that.
Well, we have commitments for football, tennis, cricket, just to name a few, in a matter of months.
Okay, well, I can speak to the matters of the Olympians who you mentioned last week. I know that those persons have been given permission to train, both during the stay at home and now clearly they're able to train. I do know that the Minister of Youth, Culture, and Sport has been working and getting the feedback from the various sporting bodies, national teams which are representing us. They are elite athletes, and we're going to put the protections around there to allow them to go ahead and to engage in that training in a safe fashion so they can represent this country well. So that is part of the things which we're going to be discussing next week of the work of the entire government. There is a government of 13, 12 ministers and myself. And we are all engaged in that work. So some of the work is spurred on by the questions that we receive from members of the media. That is the important role that the media plays. And so in that aspect, there has been a number of submissions in regards to sports. I know about football. I wasn't aware of all the other ones of which you had mentioned, but we're certainly going to make sure that persons who are representing Bermuda are clearly the athletes, and they're going to be allowed to train under the protections which are necessary in the exact same way that when our football team had an incident last time around, the Ministry of Health worked with the team to make sure that we could find a way that training could happen. We want to support those people who are representing Bermuda, and we believe that we'll be able to strike the right balance.
Last week, I asked a question about Curfew. Has there been any conversation in the cabinet regarding the persons who are under the age of 18 and in many Caribbean countries are not required to be vaccinated? We're due to host this major event in 4 months. Decision has to be made sometime soon whether or not we are going to be able to allow under 18s not to have to stay 14 days and then compete.
As for my oath, I'm not allowed to discuss decisions or discussions that take place inside of cabinet. But what I can assure you is that those discussions have been held, the concerns that have been raised, and we're working to figure out a solution so we can actually make the announcement one way or the other. But there are certainly concerns which have been presented. Certainly when we speak about Curfew and the time it's supposed to happen, the government's very clear in its indication that there's going to be the reintroduction of mandatory quarantine at the border for non-immunized travelers, which will come into place in the coming months. So it will present a difficult situation, but we're going to work through and figure out a way that we can address it.
Okay. A quick question regarding you said dual parenting. What about grandparents? If grandparents watch the kids while parents go to work, is that allowed?
What we want to do is we want to restrict the mixing of households as much as possible. And so from that perspective, that would not be something that would be permitted inside of the regulations. These are all very difficult and challenging discussions. But these are some of the things which we're going to continue to socialize, because right now where we are, it is too risky. And because there is virus transmission which is taking place, it is too risky. There will be additional guidance that is going to be released. There are conversation discussions around it, versus what is actually safe. The regulations you're putting in place are to make sure that people remain safe. So at this point in time, under the strict interpretation of the regulations, that would not be permitted.
Okay, I have one last question. Well, it's widely anticipated, and we spoke about this last week, that once all the sailors, the officials, and the equipment are removed from Cross Island, we'll go back into a lockdown. What do you say to assure people that every measure will be taken not for this to happen?
Earl, I would just say for people not to try to spend so much time engaging in conspiracy theories and different things. The government takes no pleasure, just so we're clear. The restrictions apply to all of us. They apply to our families. No, I haven't seen or touched or physically touched my family in 13 days. Tomorrow I get to test again, and hopefully that will end. I mean, the fact is that these restrictions are not something that we want. This is a country that has been very proud of its record in the coronavirus and the ability to mitigate it. This particular variant has set us back, and we will have to adjust our course, and that's what I'll be speaking about on Sunday. But there is no truth to those rumors, and that just doesn't, it doesn't add up.
But you're also not ruling it out.
Thank you very much.
But you mean not rule it out, Earl? We don't have to try to play gotcha. You and I, come on now. I've given the answer. We don't have to try it.
Thank you very much, Earl Baston. Media Maya, you are now live. Ask your questions, please.
Good evening, everyone. Maya Palacio here for Media Maya. My first question goes to the Premier. For nursery fees, parents have paid a month's tuition for their children only to have about 8 days at nursery. Nurseries are saying that they will not refund or subtract payment for the following month. It's understood that nurseries also have to pay their bills, but should they be keeping the money for a service they cannot provide, or can they apply for government grants so that they can possibly refund or at least give a portion back to the parents who are now out about $1,000 and have to watch their children at home and work from home?
I can just speak to the one answer is that, well, answer in two ways. The first one is yes, they can apply, absolutely. I mentioned every single time about the Bdc grants that are there to provide for the overheads that are there when you are not able to collect revenue. This is an issue that came up last year as well, and I would certainly encourage those persons in those nurseries to consider what they are doing and to have those conversation discussions with parents. But the government cannot mandate that money to be refunded, but there is the ability for those persons to apply for the grants which are able to cover overheads.
Okay, thank you very much. My second question, there have been multiple reports on a single grocery store that has consistently rising COVID cases. Even now, they are taking cashiers from other locations to fill in gaps of others on quarantine. So my question is, are cashiers allowed to work at multiple grocery store establishments? Does that not go against the current order?
Sir, help.
There is no prohibition, Maya, with respect to how a business operates as it relates to perhaps transferring staff from one location to another. What is required is to ensure that the public health guidelines are adhered to, such as the physical distancing, the hand hygiene, the wearing of masks, and the like. However, insofar as if a business operates in compliance with the public health guidelines, then the regulations don't speak to how they operate with respect to transferring staff from one location to another.
Thank you very much. My next question is for you as our Minister of Health. Does the Bermuda government believe that the mobilized quarantine order plays a role in the outbreak we are currently facing?
I'm not sure what you mean by mobilized quarantine order. Forgive me, can you be a little bit more specific?
Sure. When the government had implemented the 1 day like release, and 4 days and 8 days and then 14 days about getting tested and what you can do on those specific days, do you believe that that mobilized quarantine, that's what you called in the beginning, does it play a role in the current outbreak we are facing? Or a better question might be, do you believe a mandatory 14-day quarantine will help to decrease the spread of the virus?
Mr. Wilson, could I take that, please? I appreciate, Ms. Blosser, that you asked the question. The government has been clear, and this is the 4th consecutive press conference that the similar question has been asked. And I have stated that the government will be introducing a period of mandatory quarantine. This isn't a question of discussion. This is a question of the timing, how we're going to go about it, and to fit it in with the other things that are taking place. But allow me to say this. The mobile quarantine isn't causing the issue. It was the people that were not following, who were wearing wristbands, who were the people around them who were ignoring that advice. That is the issue that led to it. The things and rules that are put in place were there to make sure that the country was protected. And clearly there are gaps and holes in which we're going to have to address. Our battle right now is certainly the battle against variants, which we've seen. So the responses which worked last year don't work on different variants. So the mean is that you have to constantly adjust your strategies. These are some of the things in which I will discuss when we come on Sunday. But I think that I know that members of the press want to ask the same question. But for the last 2 to 3 weeks, we've been consistent over the fact that there will be a reintroduction of mandatory quarantine for our non-immunized travelers at the border. And we've been consistent in saying that for the last 2 to 3 weeks.
Thank you very much. My 4th question, possibly will probably go to you, Premier. Persons who work at the airports are finding it difficult to have days that they can go and get tested. And they're kind of wondering if there will be a test situation placed for them so that they could possibly all get tested in 1 day.
Allow me to say, Ms. Bloss, I don't know anything about that, but I do know that we don't have a shortage of testing capacity. So I will be struggling to understand that people at the airport will have difficulty getting tested. I guess if the question is that they're working from 10 to 3, and they cannot get to Penno's Wharf, which is open 3 times a week, which is not too far from the airport. If they're unable to make it then, I'm certain that if they do have concerns, they can contact their supervisors. There's testing that's at the airport. I'm certain that it wouldn't be a big deal to just have those persons swab the people working there. I'm sure we can make that happen. But I'd encourage you whoever asked the question to raise that directly. It's easier if we get those things that come through the official channel so we can figure out how to make it work. So email to premier@gov.pm should suffice.
Okay, thank you very much. I'm sure they'll appreciate that. My next question, number 5, is the Cambridge checkpoint exams and IGCSE exams will not take place this year. Can you confirm if the same rule will apply to all external exams like the IB exams?
I cannot confirm that. That question should be directed to the Minister of Education, who's not here this evening, unfortunately.
Thank you very much. My last question goes to Dr. Miller. Outside of our COVID-19 related deaths, have any of Bermuda's community deaths in the hospital been fully immunized persons?
Dr. Miller, you're on mute. Dr. Miller, you're on mute.
Sorry. Yes, certainly in relation to COVID, all the ill patients that we've had in hospital have been people who were not immunized. Outside of COVID, you will naturally within a hospital get deaths from other causes. And for those people, they were not COVID positive people at all, but they came in with unrelated things, the usual serious strokes, that sort of thing.
And were these people fully immunized?
Fully immunized means that you have at least 2 doses of the vaccine 2 weeks out.
And I think what we've addressed, Dr. Miller, is that there's no person who is admitted or currently admitted. I think what Ms. Palacio is asking is, are any of the deaths of people who have been fully immunized?
No.
Right.
Thank you very much.
Ms. Palacio, just right quick before you go, I did just get a response which came into me, which says that airport staff are definitely tested on a regular basis by the airport swabbers. They come to the molecular diagnostic lab almost daily. So whoever's asked the question, if there's a dispute on that, they're happy to send that to premier@gov.bm, and we'll do our best to resolve it.
Thank you very much.
Thank you very much. And we'll now bring in the World Gazette. Elaine, you are now live. Go ahead and ask your question.
Gazette. My first question to the Minister of Health. You've discussed a lot about the vaccination rate, how it's gone up in the last week. Can you give us an idea of how you were able to actually increase the number of vaccines in this past week, and how we're going to continue that trend so we can reach herd immunity faster?
Thank you. We are, excuse me, we intend to have a walk-in facility. What we've been doing previously is having a walk-in at the Bermuda College from 8 to 9 a.m. for persons over the age of 65. However, this weekend, we will allow anybody to come into the walk-in center from 8 a.m. until 8 p.m. Thursday to Sunday. So you do not need to register. You can just show up to, I'm just confirming the time. You can just show up to the vaccination center and roll up your sleeves and get the jab. So we are encouraging that, and we are anticipating that we will be able to continue our vaccination strategy as it relates to more walk-ins, as well as mobile units, which we are also trying to operationalize very soon. And I cannot find my note, but I believe it is Thursday until Sunday. Yes, Thursday till Sunday from 8 a.m. until 8 p.m. And again, we're also working to operationalize a mobile unit, particularly for those persons that are sick and shut in, that have not been able to have take advantage of the immunization because of their own frailties and being homebound.
Now, of course, there's a lot of discussion about herd immunity. The goal of 70% has been set a lot, but obviously that depends on what the virus is. For more contagious viruses like the measles, it's closer to 93%. Given in the last few months, we've seen more contagious variation on the island, and we've seen people who are vaccinated still being able to carry and transfer the virus. Is 70% still the appropriate goal? I know in the US, they recently said the goal would be closer to 75 to 85% vaccination.
What the scientists have indicated is that for COVID-19, bearing all of the circumstances in place as it relates to trying to get to that dead end, that herd immunity, that the region the threshold for community immunity is between 65 to 70% of the population, and that is what we are operating on.
So there's no updated figure, no changes in that regard as far as the Bermuda government's concerned?
If those changes are coming forthwith, that would be certainly on the recommendation of the CMO, but that has not been indicated at this point for Cabinet's consideration.
Now, we have heard that less than half of hospital staff have been fully vaccinated. Given they are frontline workers, especially the most frontline of frontline workers, is that particularly concerning? And what does that say about concerns about vaccinations?
Before Dr. Miller answers, I want to certainly know that, Owen, is that hospital staff can mean a lot of people, and I think it's important that we focus on clinical. It's not all hospital staff are frontline. Dr. Miller?
Yes, thank you, Premier. That's correct. Not all the hospital staff are frontline. Having said that, I would like 100% uptake, but in reality, none of the centers have achieved that. None of the places, be it Johns Hopkins or any of the hospitals, the Chelsea, Westminster, none of the places in London, New York, or wherever has achieved that. Having said that, we're pushing to see how we can get as many vaccinated as possible. We have had a high uptake among the doctors. The uptake was somewhat lower among nurses. And then some of our others who are not frontline, but they provide very valuable services, have lower figures. We have been working on ways to increase that through educational programs, because you have to realize that they live in the community where there is an abundance of misinformation on the internet and elsewhere. And there are forces pulling them left, right, and center. And just by having conversations with them in small groups, some come to a better understanding and go on to have the vaccine. I can assure you that the chief of nursing and myself go around into every single area of the hospital every day during the COVID pandemic, including Saturdays, Sundays, Easter, public holiday, every single day. And by having conversations with small groups, we have seen where by talking with 2 or 3 people who were reluctant, the next day, 2 of them turn up to our vaccination clinic. The next day, another one turn up, and so on. So the progress is slow, slower than we would like, but we're still working on the messaging, and it's slow, but moving in the right direction.
The next question will be for the Premier. You have said previously that the majority of MPs have been vaccinated, but you wouldn't go more specific than that. The One Bermuda Alliance has said all 6 of their MPs are now vaccinated. Can you give us an update on how many of the Progressive Labour Party MPs have been vaccinated? And is it concerning that the answer isn't 100% if it is not 100% yet? I mean, if you can't convince members of your cabinet and your party to get the jab, what's that say for the rest of the public?
The first thing is, it's not up for the government to try to convince anyone. It is up for individuals and a personal choice to speak to their doctor. So that's the first instance. The second instance is, I have not actually polled my members of parliament to find out whether or not they do. I have interacted with some, so I know some who have, some who haven't. So I haven't actually polled it. And I would, kind of think that that's low politics, really, to be talking about trying to compare vaccination rates. I mean, 6 versus 30, it's a big difference. So certainly there will be space and threshold. What I can say is, and this much I do know because these conversations have been held, is that every cabinet minister who is not medically ineligible to receive the vaccine has received one. That much I can say for a fact. But I haven't actually polled my MPs, because this isn't something where it's like, go get it. Our message has been consistent. Have a conversation with your doctor. Do make your own decision. And if you come to the place, assist the community. There are people who aren't able to be vaccinated. And that means that we need more persons who are able to do so, where there is no medical reason why not, that they're not going to have any reactions or side effects, that can go ahead and do that, so we can get to the place where we want to be. Nobody wants to be at home with their children, doing working from home while you're trying to work. No one wants to have the restrictions which we have in place, whether we are, coronavirus deniers or on the complete other side. There's one thing that we can agree on: we don't like these restrictions. And so the government has not very many options when dealing with a contagious virus, which has seen a significant number of people in hospital services strained, and seen a number of deaths this month alone. And so we have to recognize, we can all, it makes nice fun to argue back and forth and to say, oh, we have more than you, all the rest. That's not where we need to be. We need to be thinking about this as a community issue. And that is my hope, that we're thinking about this as a community issue. I sincerely expect that we'll certainly reach more than 70% inside of my caucus in the legislature. And I'm sure we'll be that way in the country, because the minister indicated that when there was a poll that was done of residents, only 8% of people said definitely no. And so we need to stop continuing to try to push this, everyone's afraid of getting the vaccine, to remember that our message is talk to your doctor, have that conversation. It is a personal choice, and do what has been proven to be effective in preventing coronavirus disease. The chief of staff of the hospital has confirmed no one who's been admitted for the hospital was fully immunized. That's it. The vaccine is incredibly effective against moderate to serious coronavirus disease, which is the disease which is caused by a coronavirus infection. And so it is important that we keep that in mind, that we understand where we are, and that we continue to push forward. And I would hope that the opposition, instead of trying to, score cheap political points, will say, trying to make sure to reiterate the message to the government, because there should be no sides in political arguments on this one. We want to get to a place where we have herd immunity, where we can adjust our strategies at the border and move forward to a sense of normality.
Now, earlier tonight, you said that it was vital for the people who are returning to work to get tested, those in the retail, those in the restaurant sector. Why not make that mandatory? Why not say, hey, if you're going to be going back in these frontline positions, perhaps you get tested once a week?
I sincerely know that there's people online who think that I am a strong dictator, but in this country, we have a constitution. And so we're trying to find the legal mechanisms and avenues in that regard. It's difficult. I struggle with it. I struggle with the fact that we can have the power to tell people to stay at home and restrict their freedom of movement, but we don't have the power to say, if we're allowing you to return back to work, to make it safe, to go ahead and spit in a cup so we can just do regular screening. But what I would say is I would encourage employers, because we have a choice. There are people that are coming back to work. There is community transmission. That is the fact. People are contracting the virus and have no clue where they got it from. That is the case. And so if you have reopened your restaurant, if you have reopened a retail store, and you have people inside of there that have not been tested, I don't believe that is wise, especially when we have community transmission. The last thing that you want is an outbreak at your store where you have to close again for 14 days. And so from the perspective of where we're going, because in a retail environment that there's so few people, because we're only doing curbside, that is a real possibility that your business will be shut down and close contacts will be quarantined. Not because we're trying to shut down the business, but employers can, do their own things. Employees can be responsible. You don't want to take a virus home and bring it to someone. You don't want to have the virus from your job and bring it into your house. We have free and available testing in this country. And it's important that people go ahead and avail themselves of that free and available testing. On the east end of the island, the west end of the island, there's 500 appointments a day. Just go spit in a cup, go do this. We have the ability to do it. And as long as we all do our part to go ahead and make sure that we get screened, we should be in a better place.
Now, of course, the seeming mantra for this particular level of restrictions has been no mixing of households. This might be as much for the Minister of Health as anything else, but how practical is that in small workplaces? I've been in a few kitchens in downtown Hamilton, and it's going to be very hard for people to keep social distance during a workday in small environments.
Before the minister responds, it is going to be very hard, but that's why I repeat the message for employers to make sure that their employees take advantage of the free testing which is available every day in the country. We've spoken to employer groups, Chamber of Commerce, and others to say, try to reiterate this message. That's what's vital. As we are looking to allow bits of economic activity, employers and employees should do what they can to make sure themselves are protected. Minister of Health.
I think you answered it well. Thank you.
All right. Thank you very much. Have a good evening.
Thank you.
Thank you very much. And we now have TNN coming online. TNN, we're just waiting for him to come online. TNN, you are now live. Please ask your questions.
Good afternoon. What happened?
Good afternoon, Trevor.
Good afternoon. How are you? Can you see me?
Nope.
No, your video is not on.
Share screen. For some reason, doesn't seem to be coming up.
But we can hear you fine. Please ask your questions.
Okay, so my first question, Premier Burt or Minister of Health, what happens if you don't reach 70% herd immunity? What's next?
Trevor, I'm going to be discussing all those eventualities when I give my address to the country on Sunday. But here's where we're focused. We're focused on getting to that figure. And that's what's important. And that's why it's an important community effort. As I've said, for persons who may be pro-vaccine, anti-vaccine, in between, speak to your doctor and approach that level. If we don't get to that level, then it will be a challenge. But those are the things which I will be addressing when I speak to the country on Sunday.
Thank you. Premier, another question for you. CNN understands that your office was in communication with lawyers from the COGP organization. Did they threaten to pull out and charge the Bermuda government for the finances lost if this race wouldn't have taken place?
I have no idea of any contact with lawyers into my office on anything in regards to that. I had one conversation with someone at CLGP. I explained the position after there was a discussion inside of the cabinet, where we took a discussion about the importance of the events, the impact it would have on our long-term ability to host events in tourism. The event was supported by the cabinet. I also had a conversation with my caucus. The permissions were given for those elite athletes to train on the period of stay at home, of course, and there'll be an event, but I have absolutely no record and or recollection or conversation about anything dealing with threats whatsoever. So I'm not entirely certain where that came from, but the source is not correct in that one, or at least didn't come to me.
Thank you. My next question for you again, sir. PLP election campaign was, your campaign used promised to tackle the high cost of electricity costs for the average Bermudan. It seems now that BALCO or the ascending group have achieved the possibility of an increase. Them indicating increase on fuel costs. We all know worldwide that the fuel cost of fuel has come down. It appears that the PLP government is in bed with BALCO because that doesn't seem like you're going to be able to find a resolution with the issue.
Allow me to say this, Trevor. I think that your facts are incorrect. And I say that your facts are incorrect because it's been clear that the oil prices have gone up. Oil prices now are about 2 to almost 3 times more than a month ago. And I just pulled up an oil price chart, which can state that, you know, a year ago, if we look at today, a year ago, oil was, what's today, 420? Oil was, well, 420 would not be a good time because that was the day that oil was at a almost negative value. But the price of oil back last April was $20 a barrel, and now it's over $60 a barrel. So it's not correct to say the cost of fuel has fallen. It has in fact risen. So there's a couple of things which go into energy prices in Bermuda. The first thing is, which goes to energy prices, is the fuel adjustment. The fuel adjustment is based under what the cost of fuel is. The second thing, which is important to note, is that the government does not control fuel costs in this country or the rates at which BALCO charges. That is done by the independent regulatory authority. The third item, which is important to note, is that this government is the first time in history or recent memory that there's actually been a reduction in core energy prices. So we can understand that there is the issues of fuel adjustment rates and other things, but the core energy tariff is something that has not seen an increase. So I think it's important to keep these things in context, and I don't actually think that it's fair, because your question is coming from a perspective that oil prices have gone down, and that is just not correct. That is not factual.
Would you consider it a rather inconsiderate to raise prices now with the average person, many people that are not working, living off of ends meet, and to increase our fuel costs or electricity, especially with many people being here and using electricity?
Well, here's the thing, Trevor. On the basis, it's not a question of whether it's fair or whether it's not fair. The fact is, here's one thing that you wouldn't want. We wouldn't want there to not be electricity. We have a regulatory authority that regulates energy in this country. The regulatory authority has actually seen core energy rates come down. But when we were talking about the price of fuel in the country, the fuel adjustment rate is set by the average price of fuel. And if the price of fuel is going up, the fuel adjustment rate will have to go up as well. Just like when the price of fuel goes down, the fuel adjustment rate will go down. But I think the other part of that is the reason why the government continues to make investments and support for solar energy. And I think that it's important that we speak about the work that the government is doing on the side of renewables. But I accept the premise of which you were saying. It is certainly not ideal, but it is the factors of how energy prices are set. Core energy rates have not increased. The fuel adjustment rate, which takes into account the global cost of fuel, certainly will have been adjusted due to the fact that oil prices this year are 3 times higher than they were last year.
It appears that you're defending Belco, but you didn't answer my question about you being.
Trevor, it's not a question of defending Belco.
Premier, prior to the election, that was one of the PLP's number one, is tackling the fuel, the electricity prices, and now you're defending them increasing, but we'll leave it like that.
No, Trevor, we're not going to leave it like that because you're trying to get in a point which is devoid of the facts. The facts are that core energy rates in the first time in memory have actually gone down underneath this government. But you are trying to equate the global price of fuel, which is not something that Bermuda, the government, or anyone can control, to something insofar as defense. The fact is that when fuel adjustment rates are set, they are not set because of how much money Belco needs or doesn't need. And I'm happy for you to have a discussion with the regulatory authority so you can understand and explain to your readers how fuel and energy prices are set in this country. But the facts do remain that, key point, that core energy rates in this country went down. And that is because of the line of which the government has taken. And so we support the work of the independent regulatory authority, and we're going to continue to support the work of the regulatory authority. But the country also needs to understand how we're going to go into the future. And that means that less dependence on foreign sources. And that's the reason why we have a very aggressive integrated resource plan to move the country to renewables.
Okay, I'm going to move on. I've had Minister of Health, I've got a large amount of calls, individuals that have been tested and they still await their results. Last week you said that that was not possible, but I got a lady that called me just today, and if I need to speak to you directly to give her name, she said to do so, but she says that she got a test on Friday. She's been waiting for a while, and she still hasn't received her results. And on the other hand, there's a two-part question. Her family was tested. Out of the 4, 2 received the results, and contact tracers have not been in contact with this family. And it's been 4 days.
Thank you, Trevor. Yeah, you can send me the contact details of that individual privately. You indicated she did get tested Friday and she hasn't received her results yet. That is very unusual. The individual, if they have their own physician, the physicians have access to the system so that they can actually receive the results and send that to the patient. We've been working with the physicians for them to facilitate that. They have been notifying the patients if there is a positive case, and that is left to the physician. With respect to the fact that you said that her whole family of 4 tested on Friday and only 2 have received the results, you said, Trevor? I'm sorry.
That's correct.
2 of them received the results. That is very unusual. The other 2 have not received the results. We have been doing quite a lot of testing, as you can appreciate, with the increase in our testing capacity. We have done that, but it is an anomaly for them to have not received their results from Friday. Excuse me, recognizing that today is Tuesday. So if you want to hit me up privately,
Sure.
I can look into that. Can I just add something real quick, Trevor, while I have the mic?
Sure.
And it's completely unrelated, but with respect to the walk-ins for the vaccination center at the Bermuda College, it is Thursday and Friday from 8 a.m. until 8 p.m. and Saturday and Sunday from 9 a.m. until 3 p.m. So I'll wait for your email, Trevor. Thank you.
Sure. Okay, since I have one last question coming from Adironka, which one is the better one? Premier Brett, we still have people that have been unemployed for over a year and is looking for an update on the second drawdown for pensions.
That was a conversation that we are continuing to have. We don't have an answer yet, but it is something that the Minister of Finance is examining. So the issue, the answer hasn't changed from last week. It's something the Minister of Finance is examining. And as I have invited the Minister of Finance to speak with Bermuda Broadcasting. I'm certain if you wish to discuss matters with him, then they will make themselves available.
Can I add just to the Minister of Health, as she just indicated about testing centers, the time, if we are to have curfew from 8 p.m., what happens if there's individuals that might leave these centers at 8 p.m.?
That is a very good question. Thank you. Under the regulations, notwithstanding the existence of curfew, if you're going to the vaccination center, as well as for testing, but more importantly, vaccination center, because you know the vaccination center does close after the curfew, you are permitted to be on the road for those two purposes. Thank you for allowing me to elaborate on that. Thank you.
Sure.
Thank you very much, Premier. There are no more questions from the media.
All right, thank you very much, Director Wilson. Thank you to the Minister of Health. Thank you to our wonderful sign language interpreters to make sure that this broadcast is accessible. And thank you to Dr. Wesley Miller, the Chief of Staff for the Bermuda's Hospitals Board. We will be, the Minister of Health and I will be back with you again next week, Tuesday, for our regular weekly press conference. But this week, Sunday, I will be giving an address to the nation. I sincerely hope that you tune in. So with that, thank you, Bermuda, and good night.